Hello, my name is Dr. Bob Bollinger, Professor of Infectious Diseases at Johns Hopkins University School of Medicine. I'm also the Director of the Johns Hopkins Center for Clinical Global Health Education and a member of the Faculty Steering Committee for the Johns Hopkins India Institute. Long COVID simply means that sometimes these symptoms that people have from this infection can last for some time. If you're someone that's having symptoms for a long period of time, it's important just to communicate with your doctor. The kinds of symptoms that people describe vary with long COVID. A lot of people notice fatigue is an issue that can continue. Sometimes people have difficulty concentrating a little bit. They have what's called brain fog that some people describe. Some people have noticed unusual rashes or sores on their skin, in particular on their feet. Those have been described with long COVID. But in general, these are quite rare complications and just something that you need to touch base with your doctor if you have any questions about that. There's also a concern in a very small minority of patients with COVID that they would have other infections in addition to the COVID. One of the things that we have to be careful about when we treat patients with this disease is to make sure that we don't give them medications unnecessarily. And because some of these medications can actually increase the risk of infections, other types of infections later on. So one of those medicines are steroids. And so we have to be careful to make sure we only give steroids to people that actually need the steroids. And those are people who have difficulty with oxygen in their blood, low levels of oxygen in their blood. Otherwise, it's important to avoid the use of steroids because the use of steroids in patients can increase the risk of other infections later on, particularly fungal infections and bacterial infections. The other thing to be clear about is that patients that have severe pneumonia, where their lungs are damaged from this infection, are particularly at risk for other infections later on that they need to monitor for. But it's also important to make sure that we don't just give routine antibiotics to everyone that has this infection, because antibiotics do not treat virus infections at all. And antibiotics are necessary only if you have another infection. If you don't have another infection, it's not necessary to use these antibiotics, and actually can increase the risk of problems with unusual infections later on.